My name is Dr. Valerie Callender. I am a clinical professor of dermatology at Howard University College of Medicine in Washington, D.C. I'm also in private practice for over 35 years. And my office is located in the suburbs of Washington, D.C. in Glendale, Maryland. I'm here today to discuss and review some of the new treatments, the fantastic treatments that we have available to treat patients with skin of color. And as you know, laser and energy devices are, quote, supposed to be unsafe for darker skin types. And I would say that's true in the wrong hands. However, we're going to demonstrate the NeoDerm laser. This NeoDerm laser is a 1064, so that's the ultimate nanometer wavelength that bypasses the epidermis. And so by doing the bypassing of the epidermis, this increases the safety profile of this laser energy device system. And I will say the short pulses, the 650 millisecond pulses or pulse duration of this laser also increases as far as efficacy and safety. Hi! So I wanted just to talk a little bit about the device. However, we definitely need to talk about the patient. You know, so the patient is probably the most important here, right? And so this is a patient who has a skin type 5, Fitzpatrick Skin Type V. And when you have the 5 and 6 patients, it's really important to know that you have to protect that epidermis. So doing that is, number one, removing makeup, right? Can't have any other issues on the skin surface. You got to clean that skin and make sure the patient is cleansed properly. And then you have to protect their eyes, okay? Because it's a laser system, you have to have full protection. Now, as the operator, I'll just have little goggles on. Am I supposed to have them on?
I have them for you when you're ready.
Okay. All right. Thank you.
Yes.
Mm-hmm. So we need the goggles. So we don't need the full protection, but we need to be able to see what we're doing, right? So it is important to be able to do these treatments and know that your patient is safe. And you definitely want to protect them at all costs. All right. So we are going to look at different skin disorders. Number one, anything having to do with hyperpigmentation, this laser is great at. Okay, so whether it's post-inflammatory hyperpigmentation, whether it's melasma, whether even if it's rosacea, telangiectasias, erythema, facial erythema, this laser is used in all those different conditions, which makes it really, really a great tool in your toolbox because you can treat multiple conditions with just one device. Now, the other good thing about this laser, and I just reviewed a paper that was published in the Journal of Cosmetic Dermatology, looking at a retrospective study of 225 patients. And what these authors were looking at is, number one, the treatment protocol, how many treatments were needed for each patient. Number two, that they could use this laser in conjunction with their topical acne medications. So it's a wonderful paper. And they also list if there was any adverse events, mild to none, okay, in all skin types. And they did have patients who are white and they had patients who were black. So they had a diversity of skin tones. So let's get this party started, okay? So we're gonna start our treatments, okay? And we have a wonderful expert here, Dana, who is going to provide the treatment for this patient. Now, she does have some hyperpigmentation around the eyes, so we're able to kind of move the goggles a little bit to get those dark circles under the eyes. And then also, too, a little bit of hyperpigmentation. So this laser is great for patients who have acne and they have hyperpigmentation, because then you can use your acne regimens that you're used to using. You can add skin lightening agents. We have some new ones on the market now, thiamidol and Melab-3, which is Melasil. So we have all these new hydroquinone-free or alternatives that we can combine with our acne treatments and the laser. All right, well, let's get started, okay? So Dana is going to perform several passes on this patient. And the nice thing about the NeoDerm is that it really helps you to pick your proper parameters. So you don't have any guessing games. They've done the science, they've done the studies, they showed where this laser, where the right parameters, where you need to have the best energy for any particular skin disorder, whether it's melasma, whether it's acne, whether it's scars, whether it's rosacea. It's perfect for you because you don't have to do the homework. It's right here for you. So I think we're going to do mode 3. And so here is your energy mode here, 3.0. This is your frequency, 2.0, how fast these pulses are going to hit the skin. And then this is your pulse width or your pulse duration. So this stays the same. You don't really move this around too much for this condition. But we definitely want to keep our eyes on the mode and the amount of energy we're pouring into the skin. Okay, let's get started. And I think what's important and what I like about this laser is that when you ask the patient about pain threshold, you know, is it from a 1 to 10? You know, how are you feeling on your skin? Feels a little warm, of course, okay? But it's very tolerable, okay? What would you say is your pain threshold right now, between 1 and 10? 2. Okay? And you would think with patients with dark skin, it would be, I'm on fire, right? No. Patients are very comfortable through this procedure. So we're doing about 3 joules per centimeter square. As you can see, it's a pattern that she's providing. Dana's excellent. She is the best trainer in the world. She has a team that will come to your office and train you and tell you, you know, exactly what to do and what are the proper steps to make sure you get a better outcome for your patients. And so you can kind of move the goggles to the side and hold it down though. So, because sometimes, you know, what about the patient jumps? All right. So anytime you're working and patients have goggles, one of your hands is actually holding the goggles. Okay. So you always want to put your hand on there, and then you can use the other hand to do your treatments. Okay. You always want to have total control on the protection of your patient's eyes. So that's important. And so we're actually looking at her skin, and I'll tell you, it's minimal redness, erythema. Don't see a lot. I don't see anything that I'm worried about. Is this going to potentially blister my patient? Are we going to have some scarring, you know, from this procedure? And I'll tell you, from experience, absolutely not. It's very safe. Patients, matter of fact, I had a patient the other day, and we actually were doing a treatment on her, and she was looking forward to her treatments. And when you're looking forward to your laser treatments, that tells you something, right? It tells you that the laser is very comfortable for you. It's an easy procedure. I'm going to get results. I'm not going to worry about adverse events, right? Because the laser is very safe. And again, patients have acne. You can use this laser in conjunction with your topical acne medications. We still recommend to discontinue your topical retinoid at least 2 to 3 days prior to the treatment. I think that's important. And I think also too is that you got to keep your eye on the patient. And when you keep the eye on the patient, especially in the skin of color patient, if you see erythema, if you see redness, don't hesitate post-treatment to apply a topical corticosteroid, maybe mid-potency. You don't need to have a high potency, at least for a couple of days to actually decrease some of the erythema. But her pain threshold is like a 2, and that is good. And I see minimum erythema. Now, I do see that we're also doing a little laser hair removal, which is really good. So she's tolerating the procedure well. And again, we can use this laser for hyperpigmentation associated with melasma, post-inflammatory hyperpigmentation. And again, I like it for erythema. And I'll tell you, one of my prized patients was someone who had a bruise from a filler, and she had an ecchymosis. And we did 1 treatment on her. Matter of fact, it wasn't fading. She was doing Annika. She was just watching it. And so I told her, come in. We did Aerolase NeoDerm treatment on her, 1 treatment, and the bruise or the ecchymosis went right away. So that was an adverse event from a filler injection. So always think in mind if you have a patient who's bruising, that they have a great protocol for any vascular event that you may have, whether it's telangiectasias, rosacea, facial erythema, ecchymoses. And so this is a very versatile system. And as you can see, the patient's tolerating the procedure very well. Dana, is there anything you want to add to the treatment?
No, I think, again, we're watching her response. I am going to be putting the correct jewels into her skin. I might focus a little bit on some pigment to give it a little extra energy to help raise it, and focus a little bit more on her under eye.
Okay.
But yeah, we're getting everything for her all at once.
All at once, okay? So she's getting a full treatment, and I say facial rejuvenation, and we're looking at her hyperpigmentation, the facial hair. She's getting the works here. And she's tolerating the procedure very well. So
We're almost done.
yeah, we're almost done with the treatment. But again, this is a laser that is so versatile, not only in the treatments and diseases and disorders you can use it on, but look at the little wheels. You can move this from room to room, okay? And that's what we do, you know, because we have to move those patients in and move those patients out. She's smiling, but we're not rushing you, okay? But in clinical practice, when you are, you know, in clinical practice, you have to make time for each room. And okay, she's all done. So she's done with her treatments. So you say, well, what's the post-op? Okay, very little. She has mild erythema. I don't have a need to recommend a topical corticosteroid to calm down the erythema. I don't need that. That's number one. Her skin looks very, it's glowing. It looks bright. And she's smiling, which is a good sign, right? And we're going to recommend just a gentle cleanser. We're going to recommend a moisturizer, definitely a sunscreen. Well, we like mineral sunblocks now, right? So a mineral sunblock to protect us, yes. Oh, she has a repair cream, which is great. That'll be very nice and soothing for her skin. So usually at night when they go home, it's definitely you're telling them to use gentle skincare. Gentle cleanser, a good moisturizer, no exfoliants, no prescription medications, you know, just be able to, you know, have the skin rest. So be very bland with what they need to use on their skin at night. But immediately, she has this moisturizer, which is very good. Skin barrier protection cream, and then we're going to apply a sunscreen or sunblock that blocks against UVA, UVB, and visible light, especially because she has hyperpigmentation, and so you want to make sure that you protect the skin at all costs. Okay, how did we do? Awesome. So yeah, so this is a great treatment for your patients.